Hey everyone, Dr. Clearfield here. Today I'm going to be talking to you about a treatment for adhesive capsulitis, also known as frozen shoulder. And so frozen shoulder is a oftentimes very uncomfortable but very debilitating condition where the shoulder gets stuck in both passive and active range of motion. So I can't bring my shoulder up, and if the doctor's trying to kind of lift it up, somebody else is trying to lift it up, it's actually getting stuck. And essentially, if you think about the shoulder joint as like a balloon, and normally it has good motion to be able to kind of go in all different directions, and all of a sudden we take some tape and we just kind of put that masking tape like all around the shoulder, and so it's just getting stuck with all these adhesions. And so what are our treatments for this? And so physical therapy is definitely a standard of care. Osteopathic manipulation can be very helpful, but if you've tried numerous different kind of things and it's just not responding, then ultimately going for surgery called manipulation under anesthesia, where they put you out and they crank on the shoulder in all sorts of different directions, and then you have to undergo rehabilitation. That tends to be the option. But there's something better that we can do, and that's actually called this glenohumeral hydrodilatation procedure. And so hydro, we're using a fluid dilatation. We're trying to kind of expand up that joint capsule, essentially trying to get that balloon to inflate itself and pop all that tape off the sides so it's not restricting it anymore. And so when we do this, we numb up the shoulder capsule first so it doesn't hurt while we're putting the fluid in there. And then we put the fluid either through the front or the back of the shoulder until that balloon kind of blows up to the point that we break that tape off. And then I will go ahead and do manipulation around that shoulder afterwards, being able to kind of break up any of those restrictions, allowing them to get the range of motion back and allowing them to get back to a normal active lifestyle. So check it out. To perform a glenohumeral hydrodilatation procedure, first we perform a nerve block of the suprascapular nerve, which innervates and provides sensation to the shoulder capsule. That way, when we perform the hydrodilatation, it does not hurt nearly as much. This is performed under ultrasound guidance, and we let the nerve block sit for about 15 minutes before we lay the patient down and perform the hydrodilatation. Once we are ready to perform the hydrodilatation, first we clean and numb up the area so that no pain is felt with the procedure. Then we insert the needle to the point inside the glenohumeral joint capsule, and we push the fluid in, essentially breaking up any restrictions, adhesions that are preventing the shoulder from being able to move through a proper range of motion. We inject a little over 50 cc's of fluid, and it's comprised of a mixture of saline, anesthetic, and a dash of steroid to have proper efficacy. After this, the area is cleaned and bandaged. We let the solution sit in the shoulder for approximately 5 minutes, and then I come back and I perform osteopathic manipulation on the shoulder to further break up any restrictions and allow them to be able to rehabilitate the shoulder appropriately. After the hydrodilatation has been performed, I come back about 5 minutes later and we do manipulation on the shoulder. So we're going to bring it through all different kind of its planes of motion, including extension, bringing it up into flexion, feeling for any kind of restrictions, and seeing how if we need to do any kind of manipulation, muscle energy, myofascial release, really working on the shoulder capsule over here, really bringing it through range of motion in several different areas that might be a little bit restricted. Then kind of taking some traction over here, making sure that okay on there with you. And bringing up over here, bringing back down over here. And bringing across into some abduction over this way here. Bringing into some abduction over this way here. Bringing it back into some internal rotation. You okay back there? Bring it right over here, really stretching that capsule. And again, I spend a lot of time on each one of these stages as I'm kind of doing it. And then the final stage, I kind of come over and I do a pumping kind of motion over here to really free up any restrictions in that glenohumeral joint. Once I'm done. All right.